Testing 1, 2. Good evening, everyone. I'm going to start the meeting tonight by asking councillors to nominate a chairman for the next municipal year, please.
I'd like to nominate Andrew Gray, please.
Are there any other nominations? Can I have a vote, please? In favour, so Andrew, over to you.
Thank you. So I'll move to item number 2, which is appointment of a vice chair. And do we have any nominations for that? Yeah, Catherine? Caroline, sorry. Sorry.
It's all right, not to worry. I'd like to nominate Jane Ainsley, please.
And is there a seconder for that? Thank you, Melanie. And can we have a vote in favour? Oh, sorry, are there any other nominations? Can we have a vote in favour for that then? Thank you. Okay, item number 3, apologies. Was it? Yeah.
Yeah, I have apologies from Charles Maggett and Jane Ainsley, and she's been substituted by Councillor Caroline Smith.
Thank you. So item number 4, minutes of the previous meeting. I think it's only me and Sarah who were at the previous meeting. Was that? Yeah. Yeah. So there's nothing that you brought up, was there, or anything?
It was just the comments we made about the tracker and changes to the data that we received. I think we gave a whole list of how it could be laid out, because I know we're only able to do it once a year, and it doesn't seem to be in the action tracker, the bits that we commented on. You're going to ask me to repeat it, aren't you? And
Okay, could you send it to me and I'll include in the tracker then? Is that okay?
I'll have a look. Yeah, I'll have to probably go back and watch it.
Thank you. So apart from that, I think we can vote to agree the minutes. I think it's probably only me who can vote to agree the minutes, but I will vote to pass those minutes. And then we've got number 5, so declarations of interest. Are there any declarations of interest from anyone? Yeah.
I probably ought to mention that I'm now a trustee of Dingley's Promise.
Thank you. Any other declarations of interest? No, thank you. So then item number 6, public question time. I don't think we've got any public questions, have we? And number 7, member question time. We haven't got any member. No. So we'll move to item number 8, which is the Send Youth Forum. So welcome to our Send Youth Forum. We're really pleased to have you here. And so, yes, we'd love to have your presentation. Thank you.
Oh, thank you. I'm Mona Bridgman. I work at Me Too Club as a Youth Participation Coordinator. I'd like to introduce my colleague, Patrick. So I'm really pleased to be invited back again. Some of our young people spoke to your committee last June, I think. Megan was there too. For those who don't know, Me Too Club is a local charity supporting young people with any additional need from 5 to 25. And we run the Wokingham Send Youth Forum, Say Yes. And we also have a youth social action group called Include Me Too, and we've recruited and trained our young mental health champions who are doing a brilliant job in being a voice for other young people with additional needs who are struggling to get access to mental health, etc.
Yeah, and I teaching friend of mine. Okay. I was just going to say, I was teaching a friend of mine last week at the farm how to wake up.
Yeah, and you're all very good at helping others, all three of you. I want to turn to our young people to give their views first, rather than you hear me talking. I mean, young people directly experiencing the services, they've got first-hand knowledge of things, but also all the fresh ideas that you bring. Do you want to start, Megan? No? Who would like to start? No? What about you, Vincent? Do you want to talk about, because you're wanting to talk about the availability of supported internships, Vincent, weren't you?
Well, I'm an optimist.
You need to put the, press that button there, Vincent, that's it. I'll turn mine off, thank you.
I'm an optimist, and I'm enjoying it because last week I was at the farm, and this week I've been at Wellington, and on Wednesday I'm going to be at the farm again. But I might fire up this time because I'm not using that battery one. It's you can use it for an hour and then it needs charging up.
But for you, it's the experience, isn't it, that you want, because you're very clear about what you want to do as a job, but it's getting that experience from the supported internships, Vincent, isn't it?
Yeah.
And do you feel that there should be more in Wokingham, or about right, or less?
I think there should be a college that specialises in people with special needs that want to work in estates.
You've struggled to get experience in something that you're interested in doing as a career, haven't you, Vincent?
Well, this farm is doing it quick.
I'll add something to what he had just said about the options for and supported internships. I think there should be more for different things, because going into work for different things, it's difficult if you don't manage to get the right, so you struggle with understanding stuff as easily as others do. Like at first, for when I was back in school before I went into college, I didn't understand much because when it came to doing certain things, because they don't explain it the way that it needs to be explained for me to understand. So I think it would be good for there to be more options for people to have to help them get into work when they have special needs.
What about you, Megan? You came last year, didn't you? And you were talking about mental health services in Wokingham.
Yeah. Last year I said how the services in Wokingham weren't very good. And even in the last year, I haven't really seen much of an improvement, which is quite disappointing. And with the SEND team as well, I was due an annual review for my EHCP in February time. And 6 months later, in I think it was July, we then got seen by the local case officer, but I had to chase it up myself off my own back, and nobody was contacting me about it. And it took 6 months to do that. So I don't think that was right. And I think that somebody should have contacted me about it, because there was so many irrelevant stuff that was in the EHCP document that needed to be updated to what was relevant about me now and what I needed now. And eventually it finally has been updated, but it took ages, and I feel like it shouldn't have taken that long. And I know it's because there's not enough staff in the SEND area in Wokingham Borough Council. And I feel like everybody's overworked as well, and they have a lot of jobs to do, but there's not enough people. So I feel like there needs to be more people that need to be employed to be able to make young people like me feel a little bit more at ease.
Thank you, Megan. And a lot of young people that we work with say similar things about, being able to be involved in their the developing of their EHCP plan and to be involved in the annual reviews. I'm feeling that it's not they're either having to chase it up or they haven't been included, or some of our young people have said that actually it feels like they're being supervised and their behaviour is brought up and they feel like it's a sort of a group telling off. Was there anything else you wanted to say about the mental health services?
No.
No? Well, that's really helpful, Megan, thank you. What about you two? Was there anything else that you wanted to share with this committee?
Just the fact that I found that I had to get through Jack Daniels and Cokes when I was doing my college application form, because it was so frustrating. My dad was moaning in one ear, I had my brother moaning from behind me. I was like, for goodness sake.
You said it was very frustrating before, haven't you? And how difficult it was to complete.
Yeah, they could have made the questions simpler. Like, why do you want to come to this college?
Basically, it's basically stressful for us because we don't understand stuff as easy. Some people with mental health don't understand problems, don't understand that stuff as easily as others, but they make it all the stuff to suit for everyone, not taking in account for the people who struggle with it.
We really want, our young people really want things to be accessible for them, and so that they can be advocating for themselves and really understanding what they're going through.
I would say that the local offer, I know that the Woking Borough Council have been trying to make it more accessible for young people, but even the updated one that's been published is still not clear enough for what people with autism or other additional needs need it to be, because it's still quite wordy, and maybe a video would be helpful for young people to see what's going on, because that's going to be shown to 5-year-olds or 7-year-olds, and they're not going to understand some of the complex vocabulary that's been used in the new updated version.
And some people learn better from videos than they do or they understand stuff better, because at the moment everything's just written down. They don't, so it means they have to go through it, which they might not be able to keep in their mind constantly.
Absolutely. And your mum was just saying before we went in that she's found it quite difficult to find out what types of colleges there are that would meet your needs and develop your interests, wasn't she?
Well, we did think about the supported in.
Very sorry, I'm not very good at this. Yeah, you're having a good job in something that you're interested in. It's really important, isn't it?
Yeah. Next time, we mean getting a
making so it's not talking so I can actually press speak.
Wait, so it's because not everyone understands everything the same, and it's annoying because back when I was in school, they expected me to learn the same way as everyone else. They wouldn't even let me go and try and find videos or anything to help me learn. I learn better when it comes to anything music related than other stuff, because I can remember songs or rap stuff in a lot shorter time than it takes for me to remember anything else.
Okay, so was there anything the three of you would like to add?
The wait list for CAMS as well, can they be made shorter? Because there's so many people that I know of that are waiting 3 years for ADHD diagnoses or autism diagnoses and they're just being told that they've got like 3 years or 2 years to wait, and it's like, well, what are you supposed to do in the meantime whilst you wait for that diagnosis? And then there should be like other services to help people in the meantime.
Thank you, Megan. I think those waiting lists are really frustrating for a lot of young people.
As being one that's on the waiting list for an ADHD one, it's quite annoying to have to wait so long for it, and all they send is like an automated like message.
It's really tough, isn't it? Was there anything else either of you want to say?
Like even with like CAMS and that anxiety and depression pathway, that's like quite a long process. And I remember being put on it when I was 16. And I now take medication for my anxiety because I struggle with it on a daily basis. And I don't know where I would be without the medication. But when I was waiting on the wait list for anxiety and depression, it was like 2 years. And then when I turned 18 and then got seen, they were like, oh, we can't help you because now you're 18, you need to be referred to like talking therapies. So it was like really frustrating.
Really long process to get to the support you needed, wasn't it?
And like especially when like we were in crisis in 2019, not just me but my whole family, though nobody seemed to know like what to do with me. One of the things that I mentioned last year was that nobody seemed to want to help any of us as a family, and there were no services there to really support us, which is just dreadful looking back.
What do you think the council should be putting in for families going through that now?
There should just be like advice there, and there should be like more staff in the NHS to help support young people experiencing these difficulties, because there's obviously a lot of pressure on young people that are at school with exams. And I think there's a bit too much pressure. It's a little bit ridiculous, because then it then affects all these mental health issues that we then have, not just where we live, but in the whole country. And it seems to just be getting worse.
Definitely.
Well, key worker. Top to it.
You found them very helpful, Vincent, haven't you?
Yeah, he works really friendly to me.
Good, good. It's good to hear.
No, I had that issue with them on weekends.
We do.
Actually, well, weekends, I got upset with them.
But I know, Vincent, should we let the councillors ask us any questions? Because we said quite a bit, haven't we? Does anyone have any questions for our young people?
Yeah, Caroline, do you want to go first?
Thank you. I was just going to ask, you talk about to Vincent about what you'd like to do. Is that in a gardening role would you like to do?
With Optimus.
Yeah.
And in fact, I work there Monday, Wednesdays, and Fridays. And it's quite fun because we have a conservation area and I'm just there swimming in it.
No, that's good. I can tell you were enthusiastic, and thank you. And also particularly to Megan, you brought up a few points there that I wasn't quite aware of, but in my own family situation, I have seen that happen as well. So thank you for that. Yeah. And I presume there's a job you'd like to do too.
Yeah, when I'm older, I want to become a paramedic.
Oh, wow.
But at the moment, I'm currently working in childcare with babies and toddlers, like 2 to 4, and I'm going to try and like work my way up. So hopefully, like within like 10 years' time, I'll be qualified as a paramedic.
Wow. Well done. Yeah. I hope to see you one night, maybe in that ambulance. Yes. I know, but but she's so nice. You'd want her as your paramedic, wouldn't you? But thank you.
Absolutely.
Yeah.
Thank you. Yeah, sorry. What did you
I'm just going to ask if there are any other questions.
Yeah, I mean, I was just going to add. I mean, I thought it was really interesting. Firstly, what you were saying about CAMS, and I know everything that has been there's been a number of things which have been raised about that in the past. I also found it very interesting talking about the local offer and the idea of that kind of the video idea. I was sort of wondering if it was sort of presented like that, are there sort of I don't know, a couple of real key things that you would want to know from that? Are there sort of what would be your sort of top things that you'd want to be? Yeah.
Vincent, Megan wanted to say something at the moment.
I would say, so because it's targeted at all years, I think up until you're 25, you could have like key points on there about moving from primary school to secondary school, then like secondary school to sixth form or college, or what apprenticeships are available, because I went to college when I left school, but looking back, I wish that I'd gone and done an apprenticeship, because I was then going to be earning money. So I'm doing a childcare apprenticeship at the moment, and I feel like I'm learning more than being in the classroom. And like lots of like visual images, because I'm quite a visual learner, would be helpful in the video, and like just short, simple sentences. And maybe like some useful links of where people can go if they're finding it hard to transition from primary school to secondary school, what to do in an emergency, like what to do if you're feeling anxious, or finding stuff hard. And not just about school, maybe like, oh, these are the activities that you can attend in your local area. There might be like a dance class on a Saturday in like your local community centre, or there might be some sports activities going on, how to access like your GP surgery. All those kind of things I think should like be in the video.
Less words and more visual.
Yeah.
You said that in the past, haven't you, Ewan?
Excellent. Yeah, I think that's really interesting. Were there any other questions from anyone else? Yeah, Melanie.
Just wanted to say how incredibly, and I'm sure I'll speak for the council, how incredibly impressed I've been with all of you and the way you presented. And if Vincent, could I ask you a question, please? You mentioned you had an issue filling out a form because you had your dad in the one ear and your brother in the other ear, which I get that totally. Isn't there anyone who could perhaps help that's not a family member, but who would be able to give the advice?
Well, I did think about possibly getting my carer to do it, but my mum said that I needed to do it because otherwise I don't really have a signature now. Well, I do, but it's really hard to write your name down when you're concentrating on a computer game.
It's
It's being able to focus on it, isn't it? But also it being simpler. Oh, sorry.
Only two can work at a time. So to go on with the thing to do with filling out stuff, could have also the something that could be added to it is for someone having like a basic kind of form, right, with a few questions on it, but then shown in a video of like how you could put as different answers to the questions, so that you have a little bit of advice from that in case you don't want help from an actual person.
Thank you, Chris.
You kind of covered the question I was going to ask. Did there exist walkthrough videos that would take you through filling in forms? Because that sounds like it would be a great idea to have someone verbally go, this is what this bit of the form is asking, and showing examples of the kind of things you could write. Sound like there would be really good things to put in there. Do you also find being able to speed it up and slow it down and sort of move it backwards and forwards helpful? Are those the kind of things that would help?
Yes, because then because some people like to hear stuff going a little faster, or they like to have it slowed down or broken down for them bit by bit.
It's great, thank you.
Yeah. Is there anyone on the line who wanted to mention anything? Is there a is that Is Emma, is yours on?
Yes, Andrew,
Yeah,
thank you.
thank you.
Sorry, thank you, Chair. No, just wanted to say thank you, and your ideas are brilliant, and I think are something that we can take forward. So my name's Emma Cockrell. I'm the Director of Children's Services in Wokingham, and wasn't here to hear you last year, but have started working in Wokingham this year. I think certainly I'm looking at colleagues on the call, and I think making some videos is a really helpful idea, and we would like to invite you to come to one of our SEND partnership meetings, because I think sharing some of the information that you have about how it hasn't been very easy to access mental health support and support from CAMS, but also how we can think about how we can help with form filling in and making things more easier and straightforward to understand would be really, really helpful. And I can think of colleagues who are not here this evening who would really benefit from hearing from you. I mean, I can feed it back, and that is my promise to you, that I will take what you have said and feed that back. But I would like you to invite you to come to one of our meetings, because I think it would really help if colleagues were able to hear from you as well.
Megan, just wanted to add something, if that's all right, Chair.
The other thing I wanted to say that should be made easier, because I have a diagnosis of autism, I know that I can apply for like a bus pass online, and then I can get on the bus for free. However, when I've gone to go and apply for it online, it hasn't been very easy, and it hasn't wanted to take like my passport picture for whatever reason. And I was just wondering if there's like a paper copy that can be given to me that I can then fill out, and then I can then return it to here and then hopefully get a bus pass.
Yeah, that's a really, yeah. So do you want to add to that, Caroline?
I was just going to add the point that Megan also mentioned, to be involved with our EHCP in the future. I thought that was a very important point to bring forward. But yes.
Yeah, so I mean, thank you for all those points. I mean, it sounds like, is it Emma, was it the SEND partnership meeting that you mentioned? Is that what it's called? Yeah. So I think
Yes.
I suspect actually if maybe we could add this as a sort of recommendation that sort of that we go forward with that. I think then probably some of the details of things that you've mentioned, then hopefully those can be actioned upon, because I think there's some particularly interesting things in there, and I think really useful things, particularly the idea of that video, and I think the accessibility of, and I think that bus pass thing links into the idea of, you were talking about those forms for application and all those things, the accessibility of all those things. Hopefully some of those details could be maybe arranged in the partnership meeting, where we can take those forward a bit more.
Yes, definitely we can take those forward. The other thing that I would like to mention, Chair, is and just to reassure Megan regarding her worry about there not being enough staff in the SEND service to be able to respond. That's one thing that we are looking at, and we have got some additional money to support increasing the number of staff that we have within the service, so that we can respond in a more timely way, and when people need, because we know that that's something that previously we've not been able to do to the standard that we would want to, and I think you have reminded us of your experience, but that is something that just before the summer we've been looking at, and we've got some plans in place, and are recruiting some more staff at the moment, so that should help. going forward.
Something I wanted to add for the video thing is having it recorded with help from people who have mental health problems and all that, so that they can do it how they think it would help.
Absolutely, and I think from the feedback there, I think that would be a key. That would sound like that would be a really important key part of that process. Yeah, thank you for all those suggestions. I think those sound really interesting, and it's always great to sort of have the opportunity to discuss that and ask questions as well. So thank you ever so much for coming. Are there any other questions from anyone online or in the room at all? Yeah, I mean, yes, I mean, I think yeah, so I think, yeah, on behalf of everyone, thank you so much for coming. I think it's so good to have this, and I'm sure we'd like to sort of see this as a. I mean, I know you came sort of last June, wasn't it? And hopefully we can add it in again in sort of a similar time in the future to sort of have an update and keep on top of the suggestions and the things that you have to bring to us.
We really appreciate being invited. Thank you all so much.
Yeah. Well,
thank you to our young people.
Yes, thank you so much for such clear and sort of really useful feedback on your experiences. So thank you very much.
Thanks again.
I was gonna say, can you please do something about what we've said, because it's now been a year, and I know stuff takes time to happen. But can something please happen, if we come again next year, because I haven't really seen an improvement, which is disappointing.
Okay, and I think that's a really useful point, and I think we can take those back, and actually maybe we could add that recommendation of the meeting possibly also to the kind of action tracker, and then we can be reviewing that in our other meetings, so that when it comes to a year's time or something, we'll have made sure to follow up that those things have been moving forward. But yeah, great, thank you. So I think I mean, I'd quite like to propose the recommendation that we sort of take forward this in inviting those members to kind of send partnership meeting, which I think Emma's nodding. So is everyone in agreement with that? Yeah, excellent. So we'll put that in, and then I think we can then hopefully follow the progress up with that, so that hopefully in a year's time we can have some feedback with how that's got on with those specific points as well. Excellent. So we'll move on to agenda item 9, which is the executive member update. Prue has sent her apologies. I know she's at conference, but I've got a sort of a brief written update, which I think I'll just read out. So there's two things that Prue wanted to mention. The first one was that there's been a lot of concern expressed in the media about the impact of Labour's plan to impose VAT on school fees for independent schools. Officers have made an assessment of the risk of children moving from independent to the private sector, including likely numbers. We believe that we have adequate school places to cope with the likely additional demand. So that was the first point. And the second one was that it says, I am delighted. So Prue is delighted to be able to say that although children's services budgets are under pressure, for the first time that I can remember, children's services is not currently forecasting an overspend this year. So Prue would like to pay tribute to the hard work of officers in achieving this. Unfortunately, the deficit in the high needs block is still climbing despite the safety valve programme, although it is not climbing as fast as it would have been without all the interventions and mitigations that have been put in place. SEND funding is a national challenge, and we know we are not alone. this has been a period of change and one of uncertainty for SEND parents. We have yet to see what the new government will do to improve SEND funding. So those are two updates from Prue. Did anyone have any comments? I mean, Prue's not here for us to ask any questions on it, but are there any comments that anyone wanted to add with any of that? No. Excellent. So yeah.
Can I just ask how the high needs block is going to impact safety valve, and whether or not it means that we break any of the criteria that we're supposed to meet under the contract?
Yeah, it's me. Yeah, there you go.
I'm just wondering whether Emma will need to come in or not. I don't think on that question.
If I start, Ming, and then if I hand over to you in terms of some of the detail, I think Sarah, it's something we are kind of monitoring very, very closely. The original agreement in relation to the safety valve agreement was noted to be quite ambitious, but equally, I think the aims of Wokingham in terms of being able to strategically plan for children with additional needs has been equally ambitious. So it seems that whenever there's potential impact from some of the delays in achieving plans, the team is rapidly mobilising to think of mitigation plans and further ideas in which we can help realise the original ambitions. So it's currently not at risk, but it is something that we are monitoring really closely, and fair to say, with some of the additional needs and some of the spiralling costs, particularly in relation to the use of independent non-maintained special schools, that is one of the key elements that may place the original agreement in jeopardy, but it's something that we are monitoring very closely. I'll hand over to Ming if there's any additional bits that I've missed.
Yeah, Emma covered it really well, summarized really well. Internal meeting, the condition is not just a financial condition, it's about 14 work streams we need delivered. I have an initial feedback from SEN advisor DFE internal delivering our projects. They are very happy with what we have been delivered. We are on track. Based on that, we are confident we can deliver our safety valve program. It's a more than 5 years program. This is the early 1.5 years. A lot of good practice. The project I just said that we are on track to deliver good output, and outcome need to be embedded and to see the financial impact.
Great, thank you. Is there anything else did you want to add? Yeah, great, thank you. So next on the agenda is item number 10, which is the childcare support reforms, which I think Ming is presenting on.
Yeah, yes, thanks, Chair. Can I introduce Elaine? Her team do most work, and I don't steal thunder from her. So she'll give you the national context and local response, and we will invite the committee to note the development. Elaine.
Thank you, Ming. For those of you who don't know me, my name is Elaine Munro. My job title is Principal Educational Psychologist, but under the umbrella of the Educational Psychology Service, we also have the Early Years Service. And it's with that hat, that's the hat I'm wearing this evening, to go through the new changes to childcare reforms. I think everyone has received the report. So if I kind of do a quick whistle-stop tour of the main highlights, and then perhaps, if I can, answer some questions. So in the previous government, the last budget of the spring budget of 2023, the government announced 2 separate initiatives related to childcare. The first was the introduction of 30 hours free childcare for children over the age of 9 months. So previously, the childcare available from, say, April this year was for working parents of 2-year-olds, and that was to access 15 hours of free childcare, with an additional possibility of another 15 hours for some working parents. In September, just past, qualifying working parents of children aged 9 months up to 3-year-olds, because remember, all 4-year-olds already get a free entitlement of 30 hours. They are able to access 15 hours of free childcare a week in term time. From next September, qualifying working parents of children from 9 months to 3 years will access 30 hours free childcare. This obviously completely changes the landscape of childcare nationally, and I will go on to just quickly outline what's happening locally. The other strand of the changes to childcare is the development of, or the further development of, wraparound care. So this is for children who are of primary school age, so from reception to the end of year 6. The definition of wraparound care is that children can be cared for from 8 till 6, 5 days a week in term time. There is funding attached to both of these initiatives. So locally, the expansion, we have been given 55,000 to support, obviously, the new processes and the additional officer time and capacity required to implement the expansion of the free entitlement, and just over 62,500 for over the 2 years for additional capacity for wraparound care implementation. Along with that, there's some funding for wraparound care project, which will run over 2 years, and that's to support providers to increase spaces over the next 2 years. And in addition to that, there is some capital funding for both initiatives. And the DFE advice is that we will split that capital funding 80-20, 80 in favour of the expansion of the free entitlement. So in a nutshell, that's the changes that we have to implement. The free entitlement for us, our breakdown locally is 62 private and voluntary sector providers of childcare, 21 nursery classes and 1 maintained nursery, in addition to 146 childminders, not all of whom are registered to take children under the free entitlement. I think there's about 10 who haven't registered for that. So what that means for us is, as a local authority, despite having the statutory duty to make sure that there are sufficient places, we have to, in quotes, manage the market, because we don't have very much in the way of direct control. Having said that, we're in quite a fortunate position that we have a lot of interest in this area, and we've had some new providers coming into Wokingham, as well as some schools that are looking to extend their nursery provision downwards to teach some younger children. The DFE estimate, I think, that by this time next year, we will need 26 extra places. What we've well and truly, we have covered that already. However, the market, in quotes, I keep calling it the market because I can't think of another way of describing it, but we still don't know what the implications are for the expansion down to as young as 9 months. Is that actually going to change families' behaviour? We really can't tell at this point. It's early in all of this. We do know that so far, the families that have registered for their 9-month-olds to have the free entitlement for this year, the 15 hours, they've all been able to find places. We haven't had any reports of families who have registered and not been able to find a place for their child. That's the kind of free entitlement in a nutshell. The issues for all of this is that there are national issues about recruitment and retention of qualified early years staff. I'm sure you might have seen some adverts on the television about doing something big, work with small children. I can't remember the exact slogan. We're supporting, we're liaising with local training providers in colleges, and we're working with Activate Learning and University of Reading, and we're linking with the Employment and Skills team to see what else can be done to promote working in early years. It's do something big, work with small children. That's the slogan. You may have seen the adverts on the TV. As I've already mentioned, there's the management of as yet an unknown demand, and whether that, as I say, is going to change people's life choices, life decisions. So we are closely monitoring. I would say the early years team has to date a really good rapport and relationships with all our providers. So we feel as though we're pretty close to the changes that are happening. The challenge, I suppose, that you might anticipate, I would mention, is the allocation of the capital funding. Although it looks healthy, it has to stretch a long way. And being a small borough, we never seem to attract large amounts of funding. So we need to be really careful about how we do allocate the funding, and we're looking at a fair and transparent bidding process for the funds that we do have available. What else can I tell you? Oh, the other thing that we are thinking about, looking after 2-year-old children and younger is different to looking after 3- and 4-year-olds. So we are developing within the early years service some training for providers that perhaps haven't taken children as young as 2 in the past, so that they can develop an appropriate curriculum, if that's the right word, and be aware of the developmental stages of 2-year-olds and what is appropriate developmentally and what isn't. So that's a big piece of work that we're going to be undertaking from now over the next year or 2. And of course, the challenge of the increased workload on the early years team. It's great, the expansion, we're 100% behind it, obviously, but it has put the team under pressure because, of course, these timelines are always quite challenging, should I say. And then I'll quickly finish with the wraparound care provision. So as I said, wraparound care by the government definition is 8 AM till 6 PM, Monday to Friday. We're relatively healthy in Wokingham. We have a lot of wraparound, we have a lot of before and after school provision. However, we do have a fair few who do not meet that definition. So if you like, we're hoping that these are our quick wins in terms of we're in close negotiations with all our providers, but in particular for those that perhaps only need to extend their provision by half an hour a day, or maybe they finish early on a Friday or something like that. So that's our first target group. Along with, we have 4 schools who do not provide any wraparound care at all. So that is top of our list of priorities, those 2 groups. And thirdly, the other challenge that we're facing is that the wraparound care for children with additional needs. It's a challenging area nationally because providers cannot charge families of children with additional needs any more than they would charge anyone else. However, in some cases, there's pressure on having additional staff or paying staff that have additional training, paying them more. So we're working really hard to get advice nationally. We are working with Childcare Works, which is the DFE partner in rolling out both of these developments, and trying to learn what's happening in other areas and talking to our specialist providers, either schools themselves, or we have some of our providers that are interested in looking at how they can support us to provide wraparound care for children with additional needs. The pressure coming from government is that we have to use this opportunity to, if you like, front load the places, because we don't. It's a bit like we don't know what the demand is until we oversupply and see if that then again changes people's behaviours and makes them feel more confident about going into the workforce or to expand their working hours. The challenges, as I've outlined, are those that I've just said, in particular, developing provision for children with additional needs. We have set up a working group, and that's one of the areas that we've been focusing on already, and will continue to focus on for the foreseeable year. The new government has said they have asked us about questioning the funding for the second year of the original programme and how that's going to link with their pledge to have a breakfast club in every school or every primary school. So we're monitoring that very closely. And once again, we have an application process for wraparound care providers to bid for some of the capital funding that we have available to support the oversupply, to see how that develops, because of course the whole drive of this is to get more people back into the workforce after they've had families. I think that probably sums up everything I wrote in the report. I hope so.
Thank you very much. Yeah, are there any questions on these? I will have Sarah first, and then we'll go to that's.
Thank you, Elaine. That was really helpful. I just had a quick question on the training that you're developing for the early years and how that includes SEND and your health visitors, so that you know, families often say that they're unsure whether it's a developmental delay or whether it's SEND, and they're anxious about what is deemed to be normal development and what they should be concerned about. So I just wondered how it's dovetailing with SEND and how you're including your health visitors and expertise like from Dingley's Promise and that sort of thing together.
Okay, so we've got, in addition to what we're doing, if you like, internally in the early years service, there are two main developments that are happening. So we have, as you know, the SEND and Inclusion strategy, which has part of it that we've identified as specifically for early years. And the group that supports that development is a multidisciplinary group, and your colleague Terry sits on that, Terry Walsh sits on that, and we have health visitors involved in that. And a key area of that is to inform parents and professionals on things like what is typical development and when should you be worried, if you like, and then what you should do if you are worried. So we have health visitors and other health colleagues on that strand of work, and so that's in our action plan that we were just polishing off last Wednesday. And the other strand that we have is called Best Start for Life. Now, you may already have heard about that. That was a previous government's initiative, and it talked about the first 1001 days of a child's life. In Woking, what we've done is we've decided that the Best Start for Life should be from conception to 5. And again, we have, and that reports up to the Children and Young People's Partnership. So again, what we have there is a multidisciplinary group that are called the subgroup, which is quite big, because subgroup I always think means a small group, but it's actually a substantial group. But it's a subgroup of the Children and Young People's Partnership, and part of that is to look at transitions. So that was mentioned previously by our young people, but we're looking at transitions. So transitions from home to preschool, nursery, childminder. We're looking at transitions from preschool provision of any description into school, and also what that should look like for children who are perhaps described as typically developing versus children who are perhaps experiencing some additional needs and need additional support. And part of that is to inform parents what they should be anticipating, and if they don't, if they're not finding that's their child, again, who to go to and who can help with that, whether that's health, whether that's in education or early help services. So I'm sorry, that's really a very long answer to a quick question, which probably may or may not have covered what you were asking.
It did cover it. Thank you, Elaine.
Thank you for that, Caroline.
Just a quick question. You did say the 30 hours a week is term time only.
Well,
So
it's 38 weeks.
30 weeks, yeah.
38 weeks.
Yeah. Is there any thought about covering the extras in the future?
I think that's a kind of political decision.
I know. Sorry, I put you on the spot there. It's just I listened to there was a long programme the other day about parents saying this is great, but you still have long periods where you have to find the money. So
that's that. Yes, I mean, so we do have the half programme, which is the. Gosh, now you see, I was about to show off and tell you what that was, and I can't remember what half stands for. But there are holiday clubs and after school things. But yes, they do have to be. Otherwise, it's private providers for holidays. So I'm sorry, but I'm not sure politically whether that's going to be a new target for.
I apologise. That teaches me to listen to Radio 4 lunchtime. Thank you.
We all?
Thank you. I was just going to ask one thing as well. I think it was related to what you were saying about children with additional needs. You may have touched upon this a little bit, but it was about the sort of the funding and the sort of who I was wondering who funds the difference for supporting places for children with additional needs. Would it be down to the local authority? And I guess if providers, is there any risk that those children might be refused places with private providers based on the fact that if they couldn't feel that it was financially viable with the right ratios of staff and things like that?
If I take the second part of the question first, yes, it can be that private providers, because they are private providers, and wraparound care is something that is paid for by families, it can be seen as it's not financially viable. And the whole thing, one key part of wraparound care is also attracting staff, because you're asking staff to work from before 8 till 9 in the morning, and then from 3 o'clock till 6 o'clock. So, it's not an easy sell to get people to come and work those hours. So what we're trying to do is to encourage providers to perhaps offer reduced or free wraparound care. For example, if you're a parent and you're working in that, working for that provider, if you like, to try and keep the costs down. There are, and please don't ask me all the details on this, but there is tax-free childcare, and in some cases for children with additional needs, that is a higher amount. We are working very closely with childcare works to get the detail of how that applies. So that would mean that some parents would have an additional source of funding. But I'm not sure what the rules and regulations are around how they would use that. But that is something we're trying to get clarity on at the moment. I'm not sure if that's addressed your question, but I suppose the funding that we have for wraparound care for this, well, definitely 1 year, we're waiting to see what they're saying about the next year, would be to create an environment where someone would want to come in to support children with additional needs, to give us an opportunity to look at what was viable and how that could be supported. Because at the moment, we're hoping that out there's great innovation happening. If we could just give them a bit of pump priming to try it and see how it works.
Okay, so
sorry, it's a bit of a vague response.
No, that's fine. So I guess I'm wondering is so is that a sort of local authority intervention that would happen for those to sort of make sure that those children aren't necessarily disadvantaged in that way?
I think it is a central, it's a DFE directive that we should not, that providers of any shape or form shouldn't be charging families of children with additional needs more than they would be charging anyone else. And some of which is why we keep going back to Childcare Works, who have got the national overview of what's happening, to say, so has anyone, got any really innovative ideas about how we might go about that? So far, we're still at the early stages of finding out what's happening elsewhere. Well, we are finding out what elsewhere, and there's a lot of other authorities like ourselves scratching our heads going, we're not sure how to go about this. Complicating factors are things like children who go to specialist provision are taxied in the morning. So actually they don't necessarily need something in the morning. And then how we organise things, so how we organise transport at the end of the wraparound care, because again, they're quite often they're on school transport and might be shared. It might be shared transport, so not all of the children on that transport would want wraparound care. So those would be the kinds of things that we need to look at as a local authority. Are there ways that we could think round how we would overcome those so that it did meet the criteria of 8 till 6 wraparound care?
Okay, thank you. Chris.
Sorry, just a query for me. How many of the people providing, roughly as a proportion, how many of the people providing wraparound care are existing school staff that are just working extended outside of those hours? Because I know in my experience, the ones I have encountered are existing support staff who will start earlier and then transition into that school role and move on. I was just curious as to how many people would fit in that category.
I'm really sorry, I wouldn't be able to tell you that exactly or even approximately at this point, but I can see if I can find out. It generally is a mixture. I think what we do have is we might have, like, as you say, school staff that are working earlier and staying later, but being supported by others coming into the school. But I can certainly go away and see if I can find that out for you.
Thank you. Any other questions from anyone? Excellent. Thank you very much for that. And I think we're due to note that report, aren't we? So thank you very much for that, your work with that and with Ming as well. So
thank you.
Thank you. So we'll move on to the next item, which is item 11, which is children's social care reform, which I think is Adam. Yeah.
Evening, Chair. Adam Davis, Assistant Director of Children's Social Care and Early Help in Wokingham. So submitted this report, which board members would have seen, had the opportunity to read. So in summary, it's for committee to note the nature of the reforms and service developments in train or planned. So the report lists the changes that are being introduced following reports that were commissioned by the former government, 2021, in terms of the Josh McAllister report, and also in response to some child deaths and case reviews that led to further recommendations and changes. And that led to a number of documents being published by the government, Stable Homes Built on Love, and then there was some other documents in relation to workforce, recruiting a workforce, stable workforce, and the Children's Social Care National Framework. So the report, I've detailed those to give a context and then moved on to look at the changes that are taking place within Wokingham. Some of these were in train before those reports because there were directions of travel we were already on, and others have been informed by those reports. And some of the reports, I think it's fair to say that we haven't fully formed or shaped our response in totality, because some of those are in development with some local authorities being pathway authorities in terms of trialling some of those models. So as the report moves through, I list some of those changes, and some of those things we'll be aware of. They've already been to this Overview and Scrutiny Committee in terms of developing our own residential children's homes, developing our care leaver accommodation offer, and also in there I've put in details around developments we're taking in terms of helping early help in terms of developing that aspect of our offer to children and their families in the community. And I've listed there we've recently recruited a new service manager, head of service. That was a development, a new role to develop that post and that work even further. And then it goes down into detail around the recruitment we're doing, or work we're doing around recruiting a stable workforce, because we're only as good as our staff, and stability in staff is really important in terms of relationships with children, sustaining those relationships that lead to change. And the report later on lists how we have various different channels of recruitment in terms of whether that's taking on newly qualified social workers known as ASYEs, or having apprentices in borough, or also workers having students in Wokingham that they will be supported through university to go on and qualify to become social workers. So really I won't go into much more detail about the report unless there's any questions in relation to specifics of it.
Any questions from anyone? Yeah, Caroline. Yeah.
It's only a quick one. On page 28, you say children's wishes and feelings are sought, heard and responded to. I just wondered how you respond, because what children want, they don't always get. And I wonder how you manage their wishes. Sorry.
So the bit you've identified there is part of the summary of the national framework. So that's national guidance or framework in relation to the principles, and that's very much the principles of social care. So wishes and feelings sought, heard and responded to. So as you say correctly, we may not be able to meet those wishes, but it's about how we respond to those and give a answer or reason why we can't respond to those. I think that's the nature of working with any group really, in terms of we may not always be able to meet wishes, but it's about important that we hear, work with them and work through those.
Thank you. That's what I wanted to hear, that you do work with the children. Thank you.
I think as I mentioned earlier, our social work practice is very much based on relationships with children, because that's how we create change through those positive working relationships.
Thank you. Are there any other questions from anyone else? No? Excellent. Thank you very much with that. Thank you. So in that case, we will move on to the next item, which is the number 12, which is the education and send update, which I think is Ming and Gillian. Yeah.
Yes. Okay, Chair. Once again, I would like to introduce Julian. Julian will take a member through the key development in education field. Julian is our head of education partnership. Then I will go through some key data which has been edited to this meeting.
Thank you, Ming, and good evening, colleagues. Just to bring to attention some of the highlights that I've mentioned in the report that you have, you can see, as some colleagues will be aware, I talk often about what's happening with Ofsted. It's the key indicator for what's happening in the profession. We've had in the reporting period to date 4 inspections, and you will see that Bearwood, Finch Hampstead, St Paul's and Westport all sustained their good outcomes and evidence to be celebrated sustaining its outstanding outcome. So some really positive outcomes for communities in the borough and the children attending those schools. You can see I've listed the additional Section 48 inspections which occur, which are those for schools who have a church background. So that's the statutory inspection of Anglican and Methodist schools. So we have Early St Peter's, St Nicholas's and Finch Hampstead all due for inspection in this academic year. And then I really just wanted to draw to your attention the changes that are happening in relation to Ofsted. You will have heard of the Big Listen activity that our new HMCI launched earlier on in the year when he came into post in response to the very tragic events with our colleague in Reading. There is a lot of change going to be happening and has already happened in relation to Ofsted. So we will see a number of things coming forward. There are 9 headline changes. So there will be framework reform that will come in, and a completely new framework will come in for September 2025. Today, a revised framework was published that takes effect from today. So the team are just working through what that means in particular for schools so that we can work with schools this week on those updates. We briefed schools last week on these 9 changes. So we're anticipating report cards that will come in instead of the 4 judgment areas that we have currently. There will be changes to the inspection of safeguarding. Notification is changing immediately, and schools will, in the main, only be notified of their inspection on a Monday morning, with inspections happening on Tuesdays and Wednesdays. There are a few caveats, as you would always expect around that, but that is the anticipated new modus operandi. There will be greater consistency pulled together with quality assurance happening across the nation for inspectors, and there is a new system being established for that. There's a significant change happening from this September around ungraded inspections. So those are those Section 8 inspections. And because of the changes that are happening from this September, currently all school inspections are paused until the 23rd of September, when the Section 5 inspections will recommence. But these new ungraded inspections, the changes to that process, mean that those inspections are not recommencing until the 7th of October, which gives everybody an opportunity to really get to understand what those changes are going to look like in practice. The 7th area is around Ofsted establishing an academy of training and development and recruitment for inspectors to bring about that consistency of application of the inspection schedule. They are going to investigate reducing concurrent inspections. So I mentioned just now the Section 48 inspections, which are those SIAM, statutory inspection of Anglican and medical Methodist schools. At the moment, quite often, those inspections happen in the same term or the same year as an Ofsted inspection, and recognising the additionality of pressure on teams in schools and school leaders, Ofsted are going to work with those providers to see if they can reduce the concurrence of those inspections. And then they will be looking to bring about legislative change, so that the inspection of groups can take place, such as chains and multi-academy trusts, which at the moment Ofsted is not empowered to inspect. From this September, the biggest headline change that you have probably seen in the news is the removal of the single word judgment, and that happens immediately from this September. So there are some implications for us in terms of what that means for our key performance indicators going forward. We currently report on the percentage of schools in the borough who are good or better. And at the moment, we have 95% of our schools in the borough at good or better, in comparison with 90% nationally. So we sit above that national average. So that performance indicator is going to disappear. And we're going to need to give some thought to how we think about the efficacy of the system and how we report on that at a local and with national benchmarks going forward. So I just wanted to bring to your attention some significant change in the education system with immediate effect from the beginning of this term, with a lot more to unwind over the next 12-month period. So quite a state of change in the education system currently. And then I just popped into the report for you the headline outcomes, so the initial data from the statutory assessments that took place this summer. And you will see overall children in the borough doing really well in comparison with their national peers. As I say, this is headline data at the moment, and some of that very, very raw. And as we receive the national data sets, we will be able to dig into that data and really get under the skin of what's happening for various groups with that data, which we can pick up a conversation around later in the year. So I'll pause my summary there and, Chair, hand back to you for any questions.
Thank you. Are there any questions that people want to start off with at all? No, I'll start off with one that I've got then. I think you sort of touched upon it a little bit, but with the changes to the Ofsted frameworks, I think you sort of linked to it with in terms of how that will affect our KPIs and how we measure that in terms of good or outstanding. Do we also know or have an idea how that might affect how we monitor the schools which are causing concern as well, and how that might be flagged up?
We already know that there are changes to how the regional director may be empowered or not empowered now to take action from a DFE perspective around schools who have received 2 subsequent RI judgments or have a current grade 4 judgment, so inadequate or unsatisfactory. So we understand that that machinery has been removed with immediate effect, and in conversation with colleagues at the department, we are like them still awaiting national policy direction to give us a sense of how the schools causing concern machinery will work going forward. So that is something that we're still waiting for an update on from ministers.
Thank you. I think Ming wanted to come in as well there.
Yes, Julian cover all of it. I just would like to add, Julian mentioned for next year, the Ofsted going to use reporting card instead of single words grade. They are still developing criteria, what kind of criteria to be included in the reporting card. But one thing they already confirmed, they definitely want to include inclusion. I think which is good. Another thing Julian mentioned, there will be regional improvement agency be set up. On top, in addition to Ofsted inspection, there will be annual safeguarding, inclusion, and off-rolling review of school. Exactly how to review it. They review with together with local authority or together with other partners. They are still working on that. I think that means as the local authority, probably as the police committee as well, will have more chance to scrutiny schools to work in inclusion. Yeah. Sir Martin of the chief inspector said very clearly he wants to focus on inclusion and also make connection to among other area work, safeguarding, how school really work together with other partners in terms of make sure children's mental health being delivered with a partner, how children's well-being being look out well, how children were safeguarded, all those going to be focused. I think that will inform probably our future KPI performance indicator, like Julian just mentioned, probably for the KPI bring to this board as well.
And just to add, Chair, that we're anticipating a national consultation from January on the shape of those key performance indicators that will go into the report cards.
Excellent. Yeah, thank you. Sarah, did you want to? speak? Yeah.
Just through the parent carer network, we've also heard that what they're looking at is if all your schools in your area come out as good or outstanding, but then you get a local area SEND inspection that says you're not very inclusive, that actually the two don't dovetail. So they're looking at how they can incorporate the two, so it's a bit fairer across the system.
Thank you. And I think linked to that as well, I know sort of when we're looking at schools, we have that, as I say, that's kind of school cause for concern. Is that done on a sort of, you know, a national threshold, or if the sort of indicators become sort of a bit not quite as clear cut as they are at the moment, is that down to the sort of local authority to decide actually what threshold it would be for a school to fall under into that cause for concern category, if there's a number of factors rather than just a single word judgment for it?
And I think that is absolutely the question of the moment. So we have schools causing concern statutory guidance, and we're anticipating that there will be changes to that guidance given the changes to the KPIs that we're anticipating, and that's the policy direction that we await currently.
Okay, so we're likely to follow that statutory guidance when that comes through. Okay. So, are there any other questions about that, Chris?
With these changes to Ofsted, how are we expecting that to impact the workforce in the schools? Are we expecting that to have a positive impact on retention and recruitment, or is a period of change going to maybe drive a bit of instability and drive people away?
The basis of making the changes is in response to the feed-in from the consultation from the profession and from parents and users of the system. So the aim of the changes is to make the workload more palatable. There will be an initial period, as I think I've outlined, of additionality of work as the profession comes to an understanding of the new measures that will be in place. But what we hear very clearly from Sir Martin, the Chief Inspector, is that he wants to do that in consultation with the system. So it's very much more about co-construction than it is about a policy direction coming from somewhere else.
Thank you. Are there any other questions on those bits? No. Well, thank you very much for that. That's really helpful. And then for these, is Ming going to talk about the second part of that?
Ming is pick up the second part.
Great. Thank you very much.
Thank you, Chair. The second part is probably the knowledge in the supplementary report. Just now, early on, we talked about the pressure nationally on the SEND system, how we respond, how we perform, etc. So at last meeting, for that member would like to know more about exactly what kind of pressure exactly. So we give them more sort of information on this occasion about particularly on SEND system. I don't want to go through to repeat Julian just said, internal education outcome, school children's academic outcome, working on doing really well. I think I'm confirmed not finalized figure, even GCSE, Key Stage 2, A-level are doing well. Our SEND children's outcome also better than national average, regional average, and statistical neighbors average. Our similar barriers, our SEND children perform particularly well. I think that's credit to school, to all partners, and the parents themselves, young people themselves as well, they're doing well. But I would like to highlight some challenge in terms of data dashboard about EHCP. We work under the principle your children, young people need to be assessed, we wouldn't want to set any target or number. So very much need, we want to address need. That's our focus. As you can see that, you look at that just quarter one, you compare to last quarter, we have slight increase, the arrow increase upward. I know last time on one occasion, remember to indicate with the arrow up or down. What that mean? I think let me increase. Very difficult to say that it's a good thing or bad thing. I can say if children you need to have EHCP place in the borough or outside the borough, we have to place them. So those are the slight increase in both EHCP children young people place both in borough and out of borough. And in issuing EHCP, that is, as you know, that is a requirement. All those assessments need to be delivered within 20 weeks. Nationally, it's around 50%. We have been put great work with the partner. As you can see, that throughout past 6 quarters, we make great effort. Some quarter we improve great deal. We link with like occupational therapies service, health service, or educational psychology put a great effort as well. Just to explain, those input from educational psychologists, occupational therapy assessment, they need to complete for 6 weeks. You let for 6 weeks not complete, almost certainly you cannot complete it within 20 weeks. So all those parts play a role. Just now we talk about the pressure. When we talk about saying including same thing and educational psychology thing, externally, occupational therapy, etc. So the latest quarter we had to drop. That reflect what Emma just saying. Really, I think we have a staff shortage. We have people that like council really support you. The corporate center supported by member as well. Invest more in our same thing. At the same time, partnership getting stronger. So we want to get the commission of occupational therapy, etc. in place. So we are confident in the overall trajectory. I think we look at the past 12 months, it's around 68, 69%. So you will see 1 month may go down, another month go up, but we want to have a sufficient workforce to make sure, I think this trend is consistent. Of course, it cannot always go up and up. So that's the picture we have. Slight increase in EHCP placement, and there's a big drop in EHCP being issued within 20 weeks. Let's in Saint Sophia, you allow me to go on to look at another inclusion with internal children missing education. Children missing education, actually, I just would like to give you context. There are 2 kinds of children missing education. DFE, children missing education definition is children actually not enrolled at school. But some local area can interpret different way. Children are being absent for a long time. You can then miss children missing from education. So we talk about children not enrolled currently. We have 12, which again, we would like to see no children not enrolled, but if we compare to national average, it's much lower. So why children are not enrolled? Mostly because they just arrive in the borough. There will be processing time, lead time, for they make application for school, for the school admission survey to find the right place. Sometimes parents ask, they really adamant want to go to certain school. So there is some time to talk with the parent, to go through the system, and then we have to convince the parent we have to allocate some school with place in certain year group, etc. Another factor is the same children, young people who need a special school placement. We carry out consultation, so I need to take time. School A, we consulted, we wait for a week or whatever, and then they come back to say that now we can't meet this child's need, and then we have to consult another one, or we go back to challenge them. So because of those time lapse, so that's mostly the children missing education, not because they are forgotten, they are in the process. We are 12, it's lower than the national average. in terms of permanent exclusion, I think you look at the whole year's figure. This year we have slightly higher than previous year, but this quarter one, we managed to reduce this slightly. And we look at the exclusion to look at the source of permanent exclusion, and found it highly concentrated in actually one particular school, and then another school slightly more. Most school, like I said, the 10 secondary school, for example, I can see 8 secondary school actually reduce the permanent exclusion. So you have a minority of school actually had a big increase. There's exceptional circumstances for the particular school. I will not want to name here, but they have a particularly challenging year for that school. The trust, probably internal managing behavior, whatever. From their point of view, they want to take a tough stance that so end up with a more permanent exclusion. So that's why this year we see the slight increase in permanent exclusion. So far, we look at this year, look at past 12 months, 26, previous years, 24, 2 more. But it's highly concentrated in a couple of schools. And the service work, we make this a priority. It's very, very important, particularly those children, young people with special education need. We always advise school, you shouldn't use this permanent solution for children with special education need. And of course, advise school is one thing. The tool, the way we empower school to do that is very important. That's why we also carry out what we call AP remodeling. So alternative provision, the foundry will play the greater role to step in when the child needs help, when school asks for help. One example, very positive development. Remember, I think I would like to say that I think we set up AP remodeling. One of the things we're doing, AP are not just sitting there waiting for the people at school that, oh, I can't manage, go to alternative provision. Just in case some member don't know what AP is. It is sometimes you call it PRU, people refer unit. When children need to time out, they go to PRU. So we remodel it kind of change PRU or AP into a place actually reach out to school to offer school support. Also to be a place where multi-agency colleagues like Elaine's educational psychologists, health colleagues, social care providers, and school leaders themselves sit together, have a forum, what we call multi-agency practice, inclusion practice clinic. It's a practice clinic to discuss all the cases school feel really challenged. Either I want to permanently exclude the child or someone from AP need to take the child. So I observed 3 multi-agency inclusion clinic. Many cases are being resolved. Children stay in mainstream school. They are not permanently excluded. This is the beginning. We have soft launch, have 3 pilots. So this month we just have a formal rollout of this program. So let's give you an example the way we deal with the permanent exclusion to empower school, not just advise school not to permanently exclude. It's very important. What's the good alternative to permanent exclusion? Instead of just saying don't permanently exclude. Yeah. So I think I give you all the data you requested on last meeting or the committee meeting. I just wondering whether any question on me.
Yeah, thank you very much for that. Are there any questions? Should we well, should we go through any questions on dashboard 2 to begin with? I think because we're on that one already. Are there any questions on that? On dashboard 1, yeah. Should we go to dashboard 1 then? Do you want to read? Yeah, Sarah.
Evening, Ming. My question is around, I know that you're looking at staffing and the SEND team structure, when you think that might be fully staffed, because obviously that's affecting some of the timeliness. And I was also curious about professional reports and whether that's also impacting the timeliness.
Yes, indeed. We aim to, well, full complement is the right word. Now, sometimes the market is very, very tough. We have already started recruitment. We rather to have qualified, suitable staff to be recruited instead of just appointing someone who just come in for a few months and then decided I can't do the job to go. So we think by the end of October, we will be able to recruit all necessary actual staff that we put out at, I think just today we put out an actual ad. We just think how we can manage it at good. I think corporate, the partners support us to have this increment. But when you have many vacancy advertised, sometimes people know this is quite smelly. Why this place have so many posts being advertised? But I think we have good story to tell, and we're confident by the end of October, around that time, we will have a most staff recruited. I think Emma.
Thank you. Yeah, Emma, do you want to come in on that?
Yeah, I think further to Ming's comments and your question, Sarah, it's not just about making sure that we've got a full complement of staff. It's making sure that we've also had the opportunity to train and develop those members of staff so that they are operating in to a standard and expectations that we would have. So that's the other piece of development that's being planned in parallel. So as new staff are joining, they're inducted properly and are receiving the right support in terms of making sure that they've got an opportunity to be successful in their roles, because that's really key in this work as well.
Yeah, I would just like to add as well, when we talk about SEND, as I said earlier, it also include Elaine's survey, actual psychologists. That survey is really also really in a dilemma or delivered early intervention surveys or go into structure, what we call structured survey assessment. As I said earlier, first 6 weeks, we need to have actual psychologists assessment complete, like doing good job. And also health colleagues, occupational therapies, lay input also need to come in first 6 weeks. So very often delayed because first 6 weeks delayed, and then not just sending, even sending want to do it, it's just too late to deliver 20 weeks. So all those factors affect the 20 weeks. It's a national challenge again. It's not excuse national challenge. That's why nationally it's just under 50% and then sometimes 50%. Yeah, we are working on that. We have confidence we can improve on that. I think you look at the average, actually you will already improve on. About 12 months ago, when we look at the 12-month average, it's under 40%. Now I think we are about 65, 60 to 67. If you look at 12 months rolling period.
Thank you. That was really helpful and really good to hear that the SEND team are going to get some good training to support the new staff in. And yes, I know Lean's team worked very, very hard, but they've been under a lot of pressure with their reports, and it's good to hear that everyone's keeping up. Thank you.
Can I share? When I allow to, would you allow me to say something extra about Ofsted? Go back to Ofsted. I just like share the good news. I was just informed by Ofsted. Sarah Clark actually part of Ofsted's expert panel on behavior. Sarah, I don't know whether you do that. Congratulations, really, from me. Sorry, I hijacked your meeting, Chair. I think I just said that probably the Poland. I was told by Ofsted that Sarah Clark is within the 7A members behavior reference group in Ofsted reforms.
I am. Thank you, Ming. Yes, thank you for that.
Great, thank you for that. Yeah, that's great. Good, really good update. Thank you. There's just one other small thing I just wanted to on about that first dashboard about the current EHCPs placed out of the borough. Obviously, that's sort of been steadily rising. Do we know if there's going to be, and with the sort of opening of the sort of new SEND schools and things like that, is that likely to have any impact and bring that down at all, or what is it likely to still be rising?
in our design, the two free same school will have a huge impact from 2026 onward. As you know that government already indicated across the country, they may not deliver all those free schools within the timeline they set themselves. So we are watching this space very closely, and we liaise with the DLV, same advisor. They support us to present any case to them. So we watching this space, but the internal timeline of DLV delivery, they may be some delay. So that may have impact, not now, from 2026 onward. But we are working on some mitigations. We already have 5-6 line of inquiry. A couple of them already put in action, like a multi-agency inclusion practice clinic I just mentioned. So that's one of the 6 line of inquiry we're doing to locally mitigate the challenge.
Thank you. Are there any other questions on either of those? Yeah, Caroline.
It's not so much about the statistics, but I'm looking at the dashboard item 3, child protection. What happens if a child with one of these orders goes out of the borough or vice versa? Does the plan follow with them, or do they just disappear?
No, sorry, I heard that it's about child protection.
I think
Sorry.
I think Adam could potentially answer that question. They don't, but certainly they don't disappear. There's a huge amount of liaison and transferring of child protection plans between area to area. But we may come to that when we come to cover off the social care update and performance.
Thank you.
Okay, thank you. Are there any other questions? Or is that? Okay, thank you very much for those. So we'll now move on to agenda item 13, which is the home to school transport policy review.
Okay, I assume everyone's had a chance to read the report, so I'll just provide a kind of brief overview of the content. So I think the first thing to note really is that we're still early in the process of the new policy. New policy only really came into effect as of the 1st of September. So whilst there has been some kind of progress, it's still kind of early days. I think, the headline is that the homeschool transport continues to rise, which obviously isn't the greatest news. But in terms of kind of where we are, in terms of the bits that we've done so far in terms of implementing the policy, there's definitely some green shoots and some kind of reasons to be kind of, I guess, cautiously optimistic. So I think the key thing to note from the report is that whilst the cost does continue to rise, it's driven by one factor and one factor alone, which is the rise in EHCPs, because SEND transport is by far the more costly component of home school transport. And whilst we are doing a job in terms of a kind of more robust application of eligibility criteria, the fact is that that is currently being outpaced by the rise in EHCPs fundamentally. So I think one thing to note is that whilst we are, our budget is increasing, we are kind of forecast at this early stage in the financial year, we are forecasting to get the budget within the actual cost within the budget for this year, which I think will be a first recently, which is a good thing. We do have a savings target of 500,000 within the budget for this year, and we're pretty confident that we'll achieve that. And there are a number of reasons for this. So, but one kind of key win that we've delivered recently is the retendering of a number of our homeschool transport contracts, which has delivered savings in the region of about £250,000, which is obviously really brilliant work by our the council's CTU in terms of their procurement work on that front. So kind of all credit to them for delivering that. Alongside that, though, it is worth noting that isn't just solely a kind of budget saving exercise. The retendering has also delivered kind of just a much more efficient service, which actually led to service improvements in that respect as well, including kind of increased numbers of personal assistants on transport. So ultimately, it's saving money, but also delivering a more robust service as well. Another key component in terms of what we've been doing so far this year is we've appointed 2 SEND transport officers to replace the 1 agency staff member that we had previously, which is enabling us to deliver some of the things that we talk about a little bit later on in the report, which have been sort of starting to kind of deliver some key initiatives which are enabling us to kind of sort of at least kind of plateau the curve that was previously going up. And then another key thing really is the fact that we have been really focusing on the more robust application of our home school transport policy. Obviously, we have a new policy that's come into effect. And I think the key headline in that respect is that whilst previously, in terms of applications received, we were looking at an 85 to 90% approval rate. We brought that down to a 70% approval rate. And that isn't us kind of rejecting legitimate applications. That's us applying a homeschool transport policy. So those people who are eligible for homeschool transport do receive it, and those who don't receive it. I think in terms of kind of where we go from here, in terms of the evolution of the policy over the application of the policy over the course of the next year, I think we're kind of adopting a triaxial approach. So on the first element of that, we're looking again to kind of really kind of ensure that our policies are properly applied moving forwards. So that will involve a couple of key elements. One element will be looking at reassessments. So whereas, you know, when we're looking at the 85 to 90% approval figure previously, that will obviously have meant that there will be people who have kind of been approved for SEND transport who fundamentally won't be eligible for it. So we'll be undertaking an exercise to reassess eligibility and to ensure that in line with our policy, that we ensure that everyone who is in receipt of transport is reassessed on an annual basis. So that we ensure that, again, that those people who are eligible receive it and those who aren't don't receive it. A key component in that as well will be ensuring that our appeals process is properly aligned. So members will probably be aware that we have a paper going to full council later this week, which looks to kind of ensure that our policies are properly applied in our stage 2 process. Key element there is obviously to ensure that where the fundamentally that parents don't get a kind of 2-tiered approach, and that those who appeal get a more favourable outcome than those who don't appeal. So ensuring fairness within the system, I think that's kind of really important, because, you know, we don't want a situation whereby people who haven't appealed get kind of less of a service than those who appeal. We want to ensure that our policies are applied systematically across the system. The second element to the approach in terms of kind of the evolution of this policy moving forwards is to look at personal travel budgets, because that's obviously a key element of what we've kind of introduced within the new central transport policies. So in terms of, that's kind of a 2-tiered approach. So in terms of what we're doing for statutory school age children, we've upped the mileage rate effectively within our personal travel budgets, which are previously at 45 pence a mile, now moving to 70 pence a mile. So a real kind of enhanced offer for parents there to kind of promote them making use of the best options that are possibly available to them. And that has actually already kind of borne fruit without us kind of having to do anything other than kind of formally make the offer. So we've seen a 60% increase in terms of uptake right at the start of the year relative to where we would be typically, which for statutory school age children. So that's automatically a great kind of result, because it means that parents have that additional flexibility to manage their transport arrangements in a way that suits them, but also is just fundamentally more cost effective for the council. So it's a win-win situation. I think the key thing there as well will be, you know, as we start to kind of push this forward with the new capacity that we have within our team, We'll be looking to kind of put together some kind of marketing materials and really kind of sell this to parents and show the kind of positive outcomes that are happening for parents who are already in receipt of those in the enhanced offer that we're delivering there. The other component to the personal travel budget is obviously the fundamental change that's been made at a post-16 level, whereby that represents essentially the core of our offer in terms of homeschool transport for children who are post-16. And obviously, we've, as noted in the report, we've had a little bit of pushback on that, but we have kind of held to that line really moving forwards, because fundamentally that's what we've agreed as a council, that will be kind of what we do at post-16 for the vast majority of parents. And as we see that kind of, I guess, because obviously parents who were previously in receipt of council organised transport, as agreed within the approval of this policy, there are some parents who, if they had applied now, would not be eligible for council organised transport, but that we are keeping on that in line with the fact that we don't want to disrupt their existing arrangements. But as they effectively age and kind of move through the system and get replaced by children who will only be eligible for a personal travel budget, that will mean that effectively our costs come down in that area as well. The third element of our approach is around ITT, and there's a good synergy between personal travel budgets and ITT, because fundamentally what we need to be doing really as children get to post-16, and potentially a bit earlier as well, but if we can sort this out prior to them getting to post-16, all the better. What we need to be doing is really, wherever possible, to enable those young people to travel independently. That's good for them in terms of their independence, in terms of their being able to access opportunities as they move into adulthood, in terms of just their general livelihood as they move forward into their adult lives. So it's a really important focus in terms of an outcomes perspective, but also from the kind of more fundamental financial perspective as well. It is more cost effective for the council if children and young people are able to travel independently. So we are at the cusp of initiating a programme of ITT. We've literally just had, I think last week, our first 2 successful completions of ITT, which have been completed by an exemplary member of our Send Transport officer team, who has personally done that herself and has received very complimentary praise from the parents involved and from the families involved. It has led to, I'll put this in kind of very clear terms. So there were 2 parents who had applied for council organised transport who we denied and offered a personal travel budget as they were post-16. But alongside that, we offered the opportunity for ITT, and these 2 parents took it up. And within the space of 2 months, we've got those parents from wanting council organised transport because they didn't think their child could possibly travel independently, to 2 children who are now travelling independently, but under their own steam. And again, that kind of works for us financially, but most fundamentally, that means we have 2 children out there who otherwise would have been on a taxi for 2 years and then would have been dropped into adulthood without those skills. But now they're able to kind of travel independently and avail themselves of all the opportunities that kind of entails, such as being able to kind of go out into the community, going to shop independently, going to meet their friends. All of these things, all these opportunities are opened up by that. So it's a really key fundamental focus for us moving forwards, is to really ramp up the ITT provision. So we're looking at exactly how we do that, because obviously we can't just have one officer kind of doing it as a tag onto a J job moving forwards, because we really want to open this opportunity up to as many children and young people as we can moving forwards. I think that concludes everything, but I'm open to any questions.
Thank you very much for that. We're doing any questions to us, Sarah, and then I've got a couple as well. That's right.
Thank you for that, Ollie. I just want to take you back to one of your opening statements, actually, about SEN being basically the fault of high transport costs. And I just think we ought to be a bit careful about the language that we use around that, because actually we have an increasing number of plans and needs for children to go out of borough. But if there were sufficient places within borough, families would hopefully want their children to go to those. So I think it's a bit of a dangerous narrative to talk around you know, that the transport budget was all at the fault of SEND children and young people. I'd just like to be really mindful of the language, if that's right.
I hope I didn't use that term. If I did, then I apologise. I certainly wouldn't have intended to use the term fault. I like I say, I think it just the reason that the cost has gone up is because of that. But as you know, like as we're able to kind of deliver more places within, which also comes within my area, more places for children with EHCPs within Wokingham, then that will be indeed a complementary factor in that respect, as well as we're able to kind of deliver places locally to parents. So, which is obviously, you know, again, a win-win for everyone in that respect. We do have a programme ongoing. I know we've noted that we have the 2 new preschools, but there is a hiatus in that respect. So I think the key priority in that respect to kind of bridge that divide in time is, you know, to look at SEND units and resource bases, because I've undertaken 2 engagement sessions with SEND Voices, and there's a key priority there, the key messaging that came back from that, which was that there was a clear will for more resource bases and SEND units, and to kind of us to really strongly diversify the offer within Wokingham. And I think the messaging that we received back from you guys in terms of the annual survey was that there was a clear will again for much more of that offer within Wokingham. So that's something we're going to be looking to really accelerate over the next couple of years, which will help both in terms of meeting parentals' kind of clearly expressed wants, but also in terms of kind of enabling us to deliver places locally, so that kind of A, brings transport costs down, but B, kind of reduces journey times for children and young people, so they don't spend as much time on transport and are better prepared for their learning when they get to the classroom.
Okay, thank you. I did have 2 questions as well, if that's okay.
Sure.
One was, you mentioned that you've got your 2 officers that are going to be involved in core aspects of it. One is budget and one's the independent travel. Is that going to be co-produced with families and children and young people? Those core principles?
Sorry, just run the question by
You
me.
mention at the end of the document, you talk about, is it in 2.12, that you've got 2 officers that are developing the council's core HTST priorities, one being PTBS and the other being ITT. Is that going to be done in co-production with children and young people and families?
Yeah, certainly. So a key element of that obviously is that we're going to be working with the families who are currently in receipt of that to develop the materials that ultimately kind of are sent out to parents as kind of like I guess advertising this offer, for want of a better phrase. So we're going to be working with the children and young people and the families who have been receiving personal travel budgets as well as ITT to really kind of like to look at how we can kind of develop the offer moving forwards and kind of gain feedback in that respect. And also then kind of take the learning from that in terms of how we can incentivize and encourage more children, young people and families to take up that offer moving forwards. But certainly if SEND Voices would like to be involved in that process and on a kind of more systematic basis, then I'd be more than happy to kind of facilitate that as well.
You know, we always love to be involved, so I appreciate that. And I'm sort of say yes, we'd also like to be involved with that work. My last question then was around, it was really positive to hear about the 2 that undertook independent training, travel training in September, but the rules changed quite a lot for September. So I'm wondering what happened to the other cohort who didn't receive that, whether we have any feedback on the change and the impact on the post-16s.
So
well, the policy changed. So you talked about how most people are changing their transport. Do we have any feedback from families at all on the impact that's had to the start of the academic year?
In terms of kind of them bebeing in receipt of PTBs rather than COT?
Yes, and how they've got to school for post-16.
We don't have any data on that at the moment, no. I mean,
will you be looking at obtaining that, because we don't have a lot of post-16 placements in Wokingham?
Sure. I mean, well, just to kind of answer a question you didn't ask, but I'll come back to that question. So what we'll say is a big focus of what we're kind of developing at the moment is actually to develop much stronger options for children with post-16 who are post-16 within Wokingham. So kind of watch this space on that front, because we are looking to kind of seriously develop our offering. That we do acknowledge that there is a kind of gap in provision in that respect. So we are looking to address that fundamentally. In terms of kind of receiving feedback, I mean, I'm happy to work with you guys in terms of how we do that. I am a little bit cautious about opening a can of worms there, because we have obviously had a lot of fundamental differences of opinion, to put it politely, in terms of kind of our interaction with a lot of parents, in terms of them feeling that they are entitled under the terms of the policy to COT, relative to the fact that we have held strictly to the fact that actually the terms of the policy do mean that they receive a PTB. So there's a lot of, I guess, parents who will probably just say that we should have provided COT. So I'm interested to know how you would think that we should engage with parents to kind of ask that question, to get, I guess, kind of meaningful answers to that question, if that makes sense.
Happy to work with you on that.
Okay.
Thank you. And did Ming want to come in with that as well?
I just want to add what Olive just offered. Sarah, I already sent you an email to set up for our next director meeting. Same voice, we're going to have more focused discussion about homeschool transport. I understand from our last conversation, sorry I missed the last one, you want to have some focused conversation. I think the question is asked how we can engage. We really, I think MI9, we really will try to directly involve young people across the same partnership with transport more. We recognize we are not doing enough for one. I think that's why we want to invite them in, kind to have direct conversation. So in our next conversation, we can co-design how we can exactly, you may have a better idea, although we have some idea to engage young people more. So I think I can assure you, I will list as a focus agenda item for our next conversation, Sarah.
Thank you, Ming. You're right. Families do really want to hear about transport, so that's great.
Thank you. Did you have any other questions with that? Is anyone? Yeah, I just had a couple of short ones. It was just about this the strict application of it and the effect of that on the stage 2 appeals, and I think in conjunction with what's coming to full council about the change. But I just wondered whether the reason that's all happened, was there an issue with the sort of stage 2 appeals panel before, which was meaning that things were going through in what might have been perceived as sort of unstrict way, I guess, or an unfair way?
To be entirely candid, as it says in the report, within the time period that is kind of surveyed within the report in terms of the appeals, there have been 4 send cases that have been taken to stage 2. The council has decided to overturn our team's decision on every occasion. I'm still very clear that on each occasion that was contrary to our homeschool transport policy, and as I've said within the presentation, that creates a 2-tier system whereby parents who we reject at stage 1 and say, you know, these are the reasons in line with the policy, and who then read the policy and say, actually, yeah, that's entirely valid, correct, and then kind of sort of remove their appeal at that stage, they don't get anything. And then, but then the parents who, I guess, kind of read all of that and say, well, I'm still going to apply, still going to appeal at stage 2, they get a different outcome, which is just fundamentally unfair. We can't have 2 rules for different sets of parents just because one set of parents decides to appeal. We need to have consistent application of our policy moving forwards, and at the moment I'm pretty clear that we don't.
Okay, thank you. Ming, did you want to comment on that?
Hello, Chair. Just out there, little matter. I think we are scheduled in the relevant forum. I think I appreciate. I think we'll come back to the member to brief you further. I think we have so reach out to many local authority and then to try to report to the member to work with the member to see what the best option they can do. I think we have already set a forum to discuss this.
Okay, thank you. And And my other sort of slight question, bit of a comment really, was with the yes, with the independent travel training. I mean, it looks like it's quite a small uptake at the moment. I know it's early days with it being in September. Is there a sort of projection for how many people might take this up during the year, and is it likely to increase, or is it likely to stay at the similar numbers which are sort of enrolled in it for September?
If we get the capacity that we need to take this forward, so I mean we're looking at just to be clear, we're looking at a couple of options. So one is to kind of extend the offer with Optalis. One is to look at whether we kind of employ a direct kind of travel trainer within the council. Another is to kind of look at options that are kind of employed in other councils. So we're looking at a variety of options, and the business case will be forthcoming in that respect. Obviously, it's going to require resource in one form or another. But in terms of what we can realistically deliver through this, I have about 20 cases at the moment where the parent has asked for ITT, and we could realistically deliver it. So yes, we can massively roll this out, and that's without us even kind of opening this up to everyone who's on homeschool transport. This is just kind of people who have applied, and we've said, you know, broadly speaking, it's mostly you can have a PTB and you know, we potentially offer you ITTs. So what we've hit at the moment is a capacity issue. But fundamentally, if we had the capacity, we could significantly increase the rollout of this.
Thank you. And sorry, you might mention, but do you think there is the capacity to increase the capacity, as it were? Is that looking likely? So two things on that. So fundamentally, it's a very clear investor save. You know, fundamentally, if we invested, I mean, I'm picking a number out of the air, but a kind of realistic number would be around, let's say 30,000, and we got 20,000. Sorry, 20,000. We've got 20 kids through ITT in a year because of that. Yeah, I don't think I probably need to explain to you that that's going to imply like quite a significant saving. So yeah, I mean, the investor save is quite clear on it. And in addition to which, as I've highlighted earlier in the report, we are looking to kind of deliver within our savings target for this year. And I think if we deliver within our savings target, then potentially we do have spare resource to kind of develop kind of initiatives such as this. Thank you. Emma, did you want to come in with that?
Yeah, I think I just wanted to stress that this is about improved outcomes for children and young people ultimately, and for those children and young people to be able to move around independently, as Ollie mentioned earlier, is really, really key. So the key aim in terms of when we talk about savings in respect of this particular budget is to be able to reinvest in services, to be able to make that difference in terms of expanding our offer, to include more children and young people being offered ITT, as well as other investment in our SEND system as well, that will make a difference ultimately to children and young people in the borough. So just needing to stress that is the key aim of this work.
Thank you for that. Are there any other questions about that? Melanie?
I'm just wondering, on table 3, applications and appeals February to August, you have mainstream application received 137 and approved 39. So I'm just interested, why is there that huge gap, so to speak?
Just trying to get to the table. Table 3. So,
yeah, page 39.
We're looking at,
yeah.
So we're looking at which row of the table?
Mainstream application received, table 3, 137, but approved 39. So I'm just interested in that gap. Why is there so much difference in that?
because a lot of people who are applying for transport who aren't eligible for it fundamentally, is the kind of, I guess, the straightforward answer. And I think, you know, part of the kind of reason for this is kind of what I highlighted earlier in the presentation, which was the fact that we're fighting against a culture whereby we've historically approved a lot of people who just weren't eligible for homeschool transport. So we're kind of a victim of that to a certain extent, in terms of the fact that we have set previously as a council set expectations at a level which just aren't sustainable and aren't in line with our policy. So, you know, parents speak to each other, and you know, the eligibility criteria for mainstream is a lot narrower than it is for SEND children. So it's very much kind of like, either you within the mileage or you're not within the mileage. So it's a lot cleaner, and so we're just getting a lot better at like applying that. But obviously, as parents are saying, well, the next time over, I got free transport for my kids, so why didn't you apply for it? And then, as we've kind of come back and said, well, actually, no, we're going to apply this policy to the letter, obviously that means that a lot of people are going to get rejected. So that's kind of the fundamental reason for that.
Thank you. Do you ever find these people come back again or appeal, or because they feel aggrieved that they have been rejected?
Well, you can see the appeals numbers there. So, you know, if you've got, let's say, 100 on the mainstream line, if you've got approximately 100 people who have been rejected for homeschool transport, then about a quarter of them have appealed. But you can see the approval rates are pretty low at stage one, and even, you know, if you say 100 people rejected in the initial application and one approved all the way through to stage 2 appeals, we're basically saying that 1% of people who applied initially and didn't get it were actually eligible. So it's I think we kind of safely say that we're applying our policy correctly in that respect.
Yeah. Thank you.
Thank you. Catherine, did you want to come in on that?
Yes, I wondered whether it was something to do with not understanding the applications process in the first place, and they tend to apply to schools that are too far away for them to get to easily. So they don't really take into account that they're going to have to pay for their own transport. And obviously, I'm thinking of Oakbank and the fact that people don't apply to Oakbank but don't take into consideration the consequences of that.
I think that's definitely a component of it, both generally and specifically in terms of the issues you've highlighted. So yeah, I mean, I guess there's expectation that we'll just transport children, whereas obviously we will transport children to their nearest suitable school, and for homeschool transport policy purposes, Oakbank is a suitable school. So yeah, fundamentally, if their nearest school is Oakbank and they don't apply to Oakbank, then they're not going to be eligible for homeschool transport.
So is there anything we can do to make it clearer to them? Or,
I mean, it says that on the form.
I mean, yeah, I know. But perhaps we should be looking at that.
I think it is important that we work with our parents and we help our parents to understand what are entitlements and what are not, and that we need to review as to whether our methods of communication are clear enough. And I think taking feedback and working with parents in respect of that, in terms of understanding, is really key going forward. We are not, to use words, fighting against parents. This is about applying a policy, and as you say, people have different understandings of even when some things are written down as to what will happen or what will not as a result of that policy. So it's really important that we work with our parents and with our communities to help understand the process. and make sure that that's transparent and fair throughout that process.
I mean, I was thinking in particular of the word suitable in the nearest suitable school. I mean, surely that's totally open to interpretation.
The legal terminology, unfortunately, which is why we use that term. But yeah, I mean, maybe we could expand on kind of what exactly that means in practice.
Yeah, thank you.
Thank you. Oh, Chris.
I'm sorry, just a follow-on question from that. We heard from the youth forum earlier that sometimes things on paperwork and forms are more challenging to people with a SEND aspect. How do we get that message out? Because sometimes that can be more of a challenge for a SEND family to understand the process. And where we get these kind of marginal cases, how can we better support people to understand whether they should be applying or not in the first place, rather than it getting to an appeal, that we've managed that expectation at the very, very beginning of the process in those kind of cases?
I mean, that's exactly what the SEND transport officers do. So they ring parents, they email parents. There is an ongoing dialogue between the two SEND transport officers and all parents who apply for homeschool transport. So of children, families of children with SEND who apply for homeschool transport. So that is specifically probably about at the moment, more than half their workload is kind of working with parents in terms of the application process and the appeals process and all of that. So there is a very clear dialogue in that respect.
That's great, thank you.
Sarah.
I think it's also important to remember that, not all schools are equal. They don't necessarily offer the same number of GCSEs or the same number of courses that you can attend, and that will also play into parents' decision making. So it's not just about, they don't think about the transport, but they're also thinking about what their child might be good at. And some schools might offer a much broader range of subjects than a smaller school. And I think it's really important that it's not just about the transport on why a school might get chosen.
Yeah, just to kind of address that point. So I guess in some terms, obviously, the parent is heavily involved in terms of the selection of the school within the EHCP, and fundamentally, whatever is named in the EHCP is defined from a legal perspective as the nearest suitable school. So if the school is named in the EHCP, then for homeschool transport purposes, for a certain child, it is determined to be the nearest suitable school. In mainstream terms, it's a little bit more kind of straightforward in terms of the fact that we just kind of use geographical distance to a school that serves children of that age group. What we'll say in that respect is that there are provisions for children, families who are economically disadvantaged. So parents of pupils who receive the pupil premium, they actually get homeschool transport to the nearest 3 schools. So for those families who might not have the economic means to transport their own children, there is provision within the legal framework and indeed within our policies to ensure that they do have extra flexibility and extra choice in selecting the school that is right for their children. And obviously the expectation is for the more financially advantaged families that they'll be able to kind of being able to make their own transport arrangements in that respect.
Thank you. Are there any other questions on that area? Great, thank you. I was wondering if we could propose a recommendation with this, that particularly with the rollout of the sort of the independent travel training and the sort of personal travel budgets being quite new, whether it's something that we could take back and review maybe later in the year how that is going. But I think particularly with the independent travel training, and maybe sort of report back a bit later in the year and sort of the uptake of it, and actually how how effective it's been, because I think it sounds like there's been some positive some really positive starts with it, and it would be good to see how that sort of develops throughout the year. Would anyone have any sort of, everyone happy with that? Yeah,
I think Easter would be a good time to
Easter. Okay,
we'll look for that kind of time. Yeah,
perfect. Thank you. We'll look at putting that in. Thank you. Thank you for all those. So we'll move on to the next item, which is the SEND and inclusion strategy.
That's myself, Chair. I'm Jonathan Wilding here to talk through these two strategies. My suggestion, I know we're up against it in terms of time, so I'm going to focus on the process and the feedback from consultation. I'm not going to dive down into the strategies themselves in any detail unless there are questions on those. Just say these are two separate but very closely interrelated and complementary strategy documents. They're distinct and separate because they each address different acts of Parliament, and one's the autism strategy is an all-age strategy. The other one applies to children and young people aged 0 to 25, so they are necessarily quite distinct and separate. But we recognise that in terms of delivery of the ambitions in the strategies, there will be a huge level of overlap and complementarity between the two, so we thought we'd consult on them together and take them through the approval process together in recognition of that sort of commonality. It's worth stressing these are both area strategies. They're not solely council strategies. They cover the whole system and cover health services, education and social care in tandem, but also the wider voluntary sector and community sectors, and you know, that wider system of agencies all working together to support these children and young people. The consultation was originally due to start slightly earlier, but due to the general election, we had to delay. We took that back to partners to see whether a delay was acceptable, because unfortunately that meant we were consulting during school holidays, which was not ideal, we'd all acknowledge, but everyone agreed. I mean, all partners agreed that given the amount of dialogue and engagement that happened building up and developing these strategies, that less than perfect consultation period was acceptable. It meant we paid a slight price in terms of feedback, but we felt that was a tolerable cost, if you like, because the alternative was to wait until the autumn term to even begin the consultation process. And there'd been a lot of dialogue around these, and we wanted to be able to progress at pace. Despite that less than perfect timing, we did get fairly good response rates. We got 52 online surveys for the Send and Inclusion, 64 for the autism strategy, but overall, because to mitigate the less than perfect timing, we spent a lot of time out attending workshops, sessions, staff forums and so on with a range of different partners. There was a lot of activity during the consultation period, and as a result of that we managed to engage with about 159 individuals who did contribute verbally and give us their feedback on the strategy. So we do feel we managed to get a good coverage for what are definitely very important strategies and very crucial. Broadly speaking, the feedback for both was positive. We've received fairly high approval levels for the strategy, the principles, the vision behind these strategies. But as you'd expect, we did get some feedback and some requests for some amendments and changes. So we have made changes, and even in the version of the Send and Inclusion strategy that was circulated since I circulated that to this group, we've actually had a Send partnership meeting. So there's a slight amendment to the vision in that strategy, but I think that's highlighted in the version that was circulated. So we have now a final text of both strategies. I think we improved the coherence and the probably comprehensibility and accessibility of the documents by making some of those changes. And we bore in mind, I think, for example, Send Voices had just published their annual survey. So we took into account the new survey findings and made sure we included that commentary, the most recent commentary in the strategy, and made sure the text all flowed from that. I think those comments I made about engagement are certainly true, but there is one area of weakness we'd acknowledge, and I think it's acknowledged in the strategy itself, which is engagement. Well, we've seen this earlier this evening. We had good engagement with the Send Youth Forum in terms of developing the strategy, but in terms of feedback on the final text, that we got commentary back that it was difficult to access. We had a few technical difficulties, so we didn't get perhaps the level of young people's engagement we might have wished for, but we think we've mitigated that, as I say, through some face-to-face sessions, and we will have a real focus on young people's engagement going forward, building on that, the excellent and articulate feedback we got earlier this evening from those young people. So that's certainly not something we're disregarding. We want to make sure we see more of that and engage in that further going forward. I think that I won't dwell on the changes we made are relatively minor, so I don't think dwell on the changes to text unless there are questions on that. I would say we now have this final text. They both have been through a kind of approval process, a separate and appropriate approval process, and they will now proceed on to executive. Well, hopefully with the blessing of this group this evening, proceed on to executive for the 31st of October, and beyond that to Health and Wellbeing Board for the 14th of November. At which point, obviously, there'll be a calling period, but then they'll become will at that stage become council policy. We will enter in the autumn, we're already in the autumn, we're already beginning to do this, but there'll be an active period of delivery planning. So the ambitions that are set in the strategies, we've already got a lot of the mechanisms in place to sort of deliver on this, but of course there are areas of particularly bringing together the autism and SEND and inclusion strategies to make sure they're pulling together in the same direction. So there'll be an active period we're kind of entering into already in terms of that sort of delivery, operational planning around delivering on some of the ambitions in the strategies. Bearing in mind the time, I'm happy to take any questions, but hopefully that's enough of a quick high-level summary of how we got to where we are. I have presented here previously the strategy documents themselves, and they haven't substantially changed from last time I presented. So I didn't think it was necessary to dive into the detail again this evening. But as I say, happy to take questions if there are any.
Thank you. That's really helpful. Does anyone have any questions about any of those in that document? No questions? Oh yeah, Caroline.
Only a quick question. On page 68, you talk about the schools, recruitment, retention to SEND staff and access training new staff. Is there any provision for some training for existing staff?
Yes, indeed. We are developing, in the process, this is actually a fairly new area in terms of a workforce development strategy. We want to do something more in concert with our health colleagues, particularly have a joined up workforce development vision and strategy, because obviously there's so much commonality in terms of the skill shortages we're facing across all sectors. So we'll be doing that in a more coherent, joined up way. I would say that piece of work to bring that together is at a relatively early stage. But in terms of the training program, we are already pulling together our SEND and inclusion training. We have a lot of SEND and inclusion training already underway. Schools have told us it's somewhat not incoherent. It's hard to necessarily know where to turn for that training. So we're bringing that together into a single calendar of SEND and inclusion training activity. That'll be pulled into, we're doing that in the next few weeks. So that'll be imminently, we'll have a single point of contact, if you like, to find the right training for schools and school staff and early years staff too. So we're making that a little more joined up than it has been, because we've had a lot of different agencies all delivering their own programs without necessarily coordinating that in a more joined up way.
Thank you.
Thank you. Any other questions? Oh yeah, Chris.
Again, just a very quick one on your accessibility on page 47. We've got a lot of written. Again, the value of spoken and video formats to digest things, I think, is not lost on me. I work with and know people who would much rather have something they could listen to at 1.5 speed. Or at 0.5 speed, because that's the way they process the information. Is that a thing that's possible?
Yes, I mean I should have included it there. We've certainly been considering publishing videos and short video pieces to help. Yes, we're trying to provide as many routes to understand and articulate what we're about and what we're trying to do. So yes, that's certainly something we're working on and we'll be doing in due course, and it should really have said so in that list, but I was focusing on the text-based documents. You're quite right to point that out, and that isn't the whole story.
And
that's
also
fantastic.
An easy read version as well will be produced, won't it, Jonathan?
Yes, we're having got confirmation of the final text, we're now able to produce our easy read version. We didn't do that for the consultation stage itself because it's frankly quite expensive and quite a slow process. It could have slowed down the consultation. We will now do that for the final text, and that's in production. Will be in production shortly.
Thank you. Any other questions from anyone else? Okay. Thank you very much for that. Then that's great. So we'll move now on to item 15, which is the. Oh right, yeah. So So should. Yes. So are we happy to? Do we want to support this? Are we happy to support this? And anyone against that? No. So that's carried. Yeah. Thank you. Thank you. So we'll move to agenda item 15, the social care update. I think that's Adam.
Evening. So the report or the data has been shared. So previously we've gone through these, and it's whether people have specific questions around the different areas of the dashboard.
Thank you. Yeah. So I think as we've sort of done previously, I think we'll just go through each dashboard and then sort of see if there's any questions with that. So looking at dashboard 1 with early help, does anyone have any things they wanted to raise with that initially? No. So sorry, this is in the it's in the supplementary agenda. Is it the? Oh no.
Yeah, it's in the supplementary agenda pack, not on the.
Adam, are you able to share the screen with this so the councillors can see it?
Yeah, I shall endeavour to do that. One moment. Is that up on your screen? So dashboard 2 is Children's Social Care front door.
To go from the first one, I think, Adam.
Okay.
Yeah, so that's the early help dashboard. Yes. That. Yeah. Does anyone have any? Yes. Does anyone have any questions on that first dashboard?
Sorry, I'll go back. Sorry, Chair.
All right. Okay, should we move to the second one? Did anyone have anything that they wanted to ask on the second one, the Children's Social Care front door?
Bearing in mind this is Q1, which we're looking back on the data here.
Nothing on there. And dashboard 3.
There was a question, wasn't there, about the process by which child protection plans, if a child moves area.
Oh yes,
Adam, I didn't know whether you wanted to expand.
So come back on that one.
Sorry,
now.
Chair.
So the local authority, so Wokingham would retain responsibility for a child who was subject to a child protection plan, who say moved to West Berks or Reading or Oxfordshire or anywhere in the country. And the local authority, Woking, would hold responsibility for that child and carry on undertaking its visits and implementing the plan until such time that the new home local authority or the host local authority that becomes a home local authority confirms agreement that they will transfer that plan over to them. And then there will be what's called a transfer child protection conference where a report is written and the chair from the new local authority would chair that meeting. The social worker will attend with the family and the new network, the new partners that are involved, and there will be a transferring conference, and then there will be a decision made at that conference whether the status of that child remains the same as they move over to that new location. So there's no gap in allocation. It retains that the Wokingham would retain responsibility, and this works vice versa. So we have a number of families that move into Wokingham. We get notified, we set up a transfer conference. The prior local authority holds responsibility until that meeting where it's agreed that will then transfer in.
Right, are there any other questions on dashboard 3? No. Okay, on to dashboard 4, so children in care. I've got one quick one on this. On the third measure, the percentage of children in care who've more than one allocated social worker, which obviously has a sort of trend going upwards. I know there's a sort of a bit of background to that. Is that mainly down to staff turnover, or is it to do with recruitment issues as well?
So Here For You, which is our team that works and looks after children in care, has had significant staffing change. There's been a significant recruitment drive, and they've recruited a lot of new workers into that team. So that will be reflected in terms of the number of changes that we've had there. The number has changed if you go back to Q1 last year. It significantly increased from 41%. I would say that 65 should then start to settle. So we also had a rise in other periods of the year where some workers had progressed onto different roles or they'd left, but this is in relation to people moving on and recruitment of new workers.
Thank you. And does the council have, if Here For You is sort of a sort of partner agency, does the council have much sort of control over the sort of turnover?
Here For You is one of our teams. It sits within. It's just Here For You is what it's called. It's a social work team that works with our children in care and care leavers. So once a child's plan has become clear that its permanency, it will leave one of the what's called the longer term social work teams and then transfer over to Here For You.
Okay, brilliant. Thank you. Any other questions on that dashboard? Nope. Okay. Number 5, care leavers. Any comments or questions on this dashboard?
But just to highlight here, the top line, really the important one, I think, well, one we spoke about before, is that we did forecast and model an increase in our care leavers, and you can start to see that occurring, and that number has continued to climb. So as I said, this is Q1. This is looking back probably just nearly 3 months ago now, into quarter 2.5 months ago. So that number's continued to climb as we forecast, as we have a number of children reaching 18 and then progressing from being in care to being a care leaver. And the other paper we shared spoke about a lot of the developments we were doing in relation to increasing our care leaver accommodation. So that's accommodation that supports our care leavers in that transitionary period, 16, 17, 18, as they start to develop their sort of ability to live independently.
Thank you. That's really helpful. Any other questions or comments on that one? No, thank you. And then if we look at the final dashboard, number 6, children missing from home and care. Any questions or comments on this one? No, that's fine.
I think there is one. There is one more. I think there, which is children's services workforce.
Sorry, I missed that one.
And that's okay. And again, and again, there is a linkage between this and the other paper where we spoke about the various different channels or that we're undertaking in terms of recruiting our workforce. And I would say that the significant headline that is started to see here in the bottom table in terms of reduction in agency staff is even greater now, where that number's continued to decline, and we're modelling that number to decline significantly down into the sort of 10-11% early next year, latter part of this year. But that's obviously modelling, which can sometimes wobble a little bit. But that's based on positives we're doing around recruitment and retaining a permanent workforce, hence the changes in Here For You that I mentioned earlier as well.
Thank you. Did you want to mention something, Caroline? Yeah, number 6 that you wanted to comment on.
Yeah, it was the definition of missing. So when you've got missing children, do we know that what's happened to them?
So most of the missing children here, we have one long-term missing child. Most who was a unaccompanied asylum-seeking child who left our care, and the child has remained open, and we keep involved in terms of trying to identify their location. Most of the missing episodes here are where a child potentially are not where they're meant to be, so they may be late, or they may be returning late or overnight, and sometimes they can be the same child on different occasions or multiple occasions, and we tend to work with that child, and we work with the network around that child in terms of trying to prevent the missing or ensuring that we understand where they are, that they're safe at those times, and we work with the police as well when they are missing. And it's the missing category is a police definition in terms of when they believe they meet that threshold.
Thank you.
Thank you. Any other questions on any of those 2 last dashboards?
And that was the last one, number 7.
Yeah, that was the last one, yeah.
Snuck another one in there.
Great, thank you very much for those then. So we'll move on next to item 16, the forward programme, which is on page 123. So we've obviously got the meeting today that we're discussing, and an overview of what we've got coming up on 6th November and 15th of January. So it's basically just to consider these and whether there's anything that the committee feels that we might want to add in. I don't know whether it's worth noting here. There was a discussion about setting up some possible training at some point. I think ideally before the November meeting, to just outline some of the key things that the committee discusses. I think we were particularly thinking it because actually there's lots of new committee members and lots to take on board and lots of acronyms to get around. I don't know whether Emma, did you want to sort of mention anything about that, because I know that was something you discussed.
Yeah, absolutely. I think that's something that we're in discussion with colleagues in democratic services to organise to support committee members, just because understanding that there is within children's services there are a lot of acronyms, and also there's some specifics about how the data is compiled, and that would be really important for committee members to understand in terms of the questions that it's important that committee members are asking us of us as officers. So just being able to provide that overview, but we haven't got a date as yet, but we will look to organise that at the earliest opportunity.
Great, thank you. And I think if possible, I think maybe if we can get it in before the next, try and get it in before the next meeting, that might be helpful if we can. A couple of points I had to maybe think about putting into the forward programme at some point was an item looking at settings other than education. So, children are educated in other places other than schools, and an overview on that. I don't know, do we need to work out exactly which meeting it might go into if we agree, or will that be sorted?
Emma, do you want to suggest one of the meetings to schedule that in?
Potentially we could look at that. I'm just looking at the agendas, the potential agendas. We could look at that for the next meeting in November, to have an update. I'm just looking back at the screen to check with Ming in terms of that possibility. Are you there, Ming?
Yeah, I'm here, Chair. So are you looking at November's meeting? We do have same voice to be discussed. I think, end of year. I just wondering whether January can be, because we already have one thing survey feedback can be, which can prompt quite a lot of questions. I just wondering, I think
in terms of timings. So if we provided that update for the January scrutiny committee, would that be okay, Chair?
Yeah, that sounds good. If everyone's happy with that. And the other thing, which I thought, which isn't in there at the moment, was looking at the an ILACS update, which is the inspection of local authorities' children's services, which I know there's sort of lots of work going on, but I wonder if that could be scheduled in. Do you know when that might be a good time to do that?
That could be incorporated into the next the specifics of the next social care update that comes to the next overview and scrutiny, because that improvement planning is part of business as usual. So to have an update on the specifics of the areas that were recommended in the previous ILACS and in the focus visit, we can do a specific report to update on that, if that would be helpful.
Yeah, that sounds good, if everyone's happy with that. Great. Is there anything else that anyone wanted to sort of raise to put forward in future meetings at all? Okay. Great. Excellent. Thank you very much for that. So that's the next item is from 17, the action tracker. I'm just trying to, which one? Is there anything particularly on here that you? Yeah, okay, so we'll go through it. So the the United Companies Asylum Seekers draft strategy, circulate the full. Has that gone through the circulation of?
So Chair, I think coming into the local authority and just reviewing, it would be unusual to have a specific strategy in relation to just US children, but we certainly would be expected to have incorporated the needs of unaccompanied asylum seeking children into our corporate parenting strategy, of which is something that is currently going through an update, and so that's something that we could potentially bring back, I think, to the January overview and scrutiny meeting.
Okay, yeah, that sounds good. So so that can come forward to that. And the next one, the holiday activities and food programs provide advisory with information levels, demands, sessions attended, and the range of activities. Was this in relation to the summer program, do we think? Yeah, would that be maybe something that there could be an because that maybe so maybe an update that could be just an update on the committee with that, particularly the summer activities. I think, I think via email I think could be fine if we could that could be circulated.
Yeah.
Then the safety valve update. Yes. I don't know what we need to.
I remember that one. If it's helpful, it was around tracking the tribunal cases and the lessons learned. So it was around, do we ever go back and look at the tribunals that come out, and do we learn the lessons, and is there anything to feedback on that?
Okay. I'm thinking about future things. Is there going to be another safety valve update scheduled in at some point, and would that be part of a consideration that we could have in that?
Just Chair, I think I'm agree. I think in our next time when we have an education thing update, we can include that.
Sorry, did you say that can be included in the next update?
Yeah.
Sorry, I don't have a safety valve update in the forward program. So when are you suggesting that we include that?
So the safety valve update would be incorporated into the overall send and education update. So that will come to the next overview and scrutiny children's.
The one on the 6th of November, we have an education update. We can have a more focused look at this particular request from members. I will cover briefly on other education development. Considering that other education outcome will take longer to get the outcome, I think probably have this focus probably right on the November education update.
Great, thank you. And then the next one was the KPIs, including column with better or worse on the KPI report. I think there's still some things with those possibly with those. Were there the things that you mentioned that?
No, I think those were two separate things. So they didn't like the better or worse, the arrows up and down, wasn't it?
Yeah. So
I think it was the fact that some indicators going up may be positive or negative. So it wasn't clear in the report whether the arrow going up was meant to be a good thing or a bad thing.
Yeah, so I wonder with those whether that could, I don't know, even whether it's a sort of color coded sort of rag type thing with some of those. I'm aware, I think, from our previous discussions that there are some things where going up or down could be seen as a neutral thing as well. But I think maybe it's worth considering. I think that there are probably some indicators where it's definitely better or worse, but I think possibly displaying that even where they are neutral things, I think it might make it easier to identify.
Chair, I think this was, sorry, I interrupted. Chair, I think this was discussed before. I think there was one of the suggestions that as another column, a single, oh no, we don't want to use single words, single words sort of commentary to say that it's better or great. I think Elaine will advise probably it was okay, leave like that. But
what about if you coloured the arrows green and red?
Yeah,
very helpful.
Yeah, I think some things, even simple like that, sort of a basic color coding or something, things like that might be helpful. I think, and just get something like that. That'd be useful.
We can look at that, certainly.
The complaints report, I can't remember. Do you know?
We had a report, I can't remember which meeting it was, about the number of complaints that the service receives. And I think, if I remember correctly, it is as it says, they wanted a bit more data at some point.
So
remember?
There was I do remember. There was a focus, Ming will remember as well, there was a focus on send and the complaints, and you set up a new process and you were going to come back and report on how that process had worked, because there's a send complaints officer now and how that was going. I think there was also going to be a policy, wasn't there, for the send complaints, Ming, if I remember rightly, because the one is based on children's services and social care, which was a bit complicated with the different levels.
Yeah, I think that when we talk about tribunal, probably the same thing, not same thing, I think a similar thing. I think we can report back on complaint, how to deal with that, the progress achieved. I think it can be done together in January. Your chair is happy with that?
Yeah, that sounds good. Thank you. So we'll put that in with the that'll link into the safety valve update. But then okay. And then the last little bits from the last one. So the office is to engage the planning department in the development of the strategy for the school place planning strategy, and future iterations to be presented to the committee. So presumably that would be with the next school place strategy. Is that?
So that process is happening in terms of the engagement with the planning department, and there are links, and I know there's discussions planned in terms of the linkage with the local plan and the overall planning. Is it that it would be helpful to have a greater articulation of?
I think so, and I guess as well, looking at the forward plan, when the next school place planning strategy would come in as well.
Holly, do you want to come in?
If I remember rightly, it was around children being able to walk to school, and that some of the children for some of the new schools that were built, there weren't footpaths, but they were able to walk safely, and they wanted the planning team to look at it as well. I thought it was around that. Was it not? You're looking blankly. You were there as well.
Yeah, I'm sorry. I'm trying. Yes. I'm not. I'll maybe go. Maybe we'll go away and look at that and take that. Yeah.
I think there was something also about the fact of the planning department creating new housing and planning for school places. There's some joint up thinking. That's what they were hoping to achieve.
Okay.
Yes.
I can probably just comment on that one. So that is definitely happening. We have regular meetings with our planning colleagues to discuss kind of forecast new development and how we can kind of deliver places in line with that. just to answer the previous question as well, the next iteration of the school place planning strategy, which has to be relabeled as the school organisation plan, will be ready in Q2 2025. So the current strategy is done and is a subject of report, but the new iteration is currently being kind of worked up. It's going to be a lot more comprehensive. Critically, it's going to include send provision. The current school place strategy doesn't. So key focus is incorporating that, so we can take a much more system-wide basis view of things in that respect. And yeah, like I say, it will be is the subject of ongoing engagement with various stakeholders. Like I said, we've done engagement with two sessions of engagement with SEND Voices on it already, and it's currently being developed. So yeah, I mean, sort of look between sort of April, May in 25, we should be looking to kind of get that into a final draft format.
So that it would be good to bring that draft here, wouldn't it, for review and with members. I think if we can slot it into a meeting at that point in time, Chair.
Yes, I think, yeah, March. Would that work? Yeah, would that work in March? Yeah.
It will be a final version by then, but yeah, March. We can definitely kind of give a much more detailed update on progress at that stage.
Okay, great. Thank you. And then, sorry, I think the last bits have sort of been covered in the point before, unless anyone wants to correct me with that. Part of those, I think, are related to those indicators which we talked about. I think it's just these first two, I guess, being added onto those. Is that possible to add those in? Yeah. Okay. Thank you. Okay. So I think those things covered, which is great. So thank you for those. So move on to agenda item 18, which is the exclusion of the public, that under section 100A of the Local Government Act 1972, the public be excluded from the meeting for the following items of business on the grounds that they involve the likely disclosure of exempt information as defined in paragraph 3 of part 1 of schedule 12A of the Act.